I'm here with Steven. I'm just going to ask you a couple of questions about what's been going on with you, okay?
Okay.
All right, so you've had this cough. How long has it been going on?
You know, I've had a cough for years, but this past week it's just been way worse.
Yeah? Do you have any idea why it might be worse?
I really couldn't tell you.
Okay, that's okay. So have you been doing anything around the house that makes you feel better, or like what makes it any worse at times?
You know, it gets real bad at night when I try to lay down to go to sleep, so I've been having to sleep with my special pillow.
Okay, and that helps? Like, does it sit you up a little bit more?
It helps a bit.
Okay. Are you able to sleep through the night?
Roughly.
Okay, I'm sorry.
It's
That's
okay.
fine. We're gonna fix you up.
Thank you.
So what kind of a cough is it? Is it?
It's pretty deep. It rattles my bones.
Oh God. And are you coughing up anything?
Oh yeah, I hate to tell you. It's pretty thick.
Okay. All right. And then if you had to rate it, what is your normal level of uncomfortableness with this cough, and what is it currently?
You know, throughout the months it's been about a 3 or 4, but lately it's up to a 5 or 6.
Okay. So Henry, are you coughing anything up right now? It's green. It's thick. It's beautiful. All right, Henry. Did you have any illnesses, serious things as a child that we should know about?
You know, I had asthma as a kid, but you know.
You haven't had any flares of that in a while?
No.
Okay. And then any accidents or injuries recently?
No.
No. Okay. Any serious or chronic illnesses?
No, I've been pretty healthy.
Oh, okay. Then do you get your flu shot every year?
Yes, ma'am, I do.
Okay. And have you gotten your pneumovax this year?
Pneumo what?
It's a vaccine and it protects you against pneumonia.
Can't say I have.
Okay, that's all right. And then when was the last time you saw your regular doctor?
I'm embarrassed to say probably over 10 years ago.
All right. Well, we should probably get you in to see a doctor sometime soon. It's really good to get yearly checkups.
It's probably about time.
Yeah, it seems like it. All right. Henry, are you taking any medications right now?
No.
No? Okay. Do you have any allergies to anything?
Oh, I do take some Zyrtex in the spring.
Okay, and all the pollen, things like that.
It bothers my nose.
Me too. I understand. So, I have to ask, Henry, are you a smoker?
Why, yes, ma'am, I am.
Okay. How long have you been smoking?
Years.
Years. Okay. Have you ever tried to quit?
I ain't no quitter.
All right. Fair enough. Fair enough. Tell me about your family history. Is there any serious illnesses in your past family?
You know, my mom has diabetes and my dad died of lung cancer, unfortunately.
Oh, I'm sorry to hear that. Did your parents smoke?
Yes.
Yeah, while you were growing up too?
My whole life.
Okay. Okay. I'm gonna ask you some questions just about your overall health. How is your skin and hair feeling lately? Is it normal? Are they brittle? Do you feel dry?
It's a little dry lately. Same with my skin. I've been a little wrinklier over the years.
Yeah, that happens. That happens. And what about your head? Have you been having any headaches, dizziness, anything like that?
I'm a little dizzy lately.
Do you think probably because of the cough, or is that something that happened before this got worse?
If I, walked around a lot. I walk my dog every day, and lately I've been getting too dizzy to keep going.
Okay. How about your throat, eyes, ears, nose? Anything going on there?
My throat's a little irritated, a little scratchy. My nose, it's all right.
Yeah. How about your smell and your taste? Is that still the way it used to be, or is that getting affected?
I think it's about okay.
Okay. And now, how about your heart? Do you ever get any chest pain, anything like that?
When I get coughing real hard, I get a little chest pain.
Do you feel like you have difficulty breathing a lot?
Yes.
Okay. Does it get worse when you're moving around?
Oh yeah.
All right. And then how about your hands? Have they been feeling cold lately? Or
they're freezing.
Oh, those are so cold.
I know.
I'm so sorry. All right. And what about? Do you have any tummy issues? Anything like like that? Is your digestive system acting up?
It's fine.
Yeah? Alright. And then how about your muscles? Anything going on there? Do you feel any like weakness, or do you use any assistive devices like a walker or cane?
Not really. My back gets a little sore with this coughing.
Alright, but other than that you're good?
I'm pretty good.
Alright. So you say you walk your dog once a day. Is that about all the exercise you get, or do you do much more activity?
I walk him to the end of the street and back, but lately I've only been getting about halfway.
Okay, yeah, makes sense. So tell me about your family. Do you live alone?
I do,
Yeah.
with my dog.
With your dog? Okay, not alone.
I'm not totally alone.
No.
You know, man's best friend.
I know. I love dogs.
Me too.
So are you in a relationship at all? Are you married?
No, ma'am. My wife died about 2 years ago.
I'm so sorry to hear that.
Never been the same since.
I understand. What about any other family in the area?
My granddaughter, she lives nearby. I go to lunch with her about once a week.
Oh, that's so nice. So you feel like you have good, adequate family support around?
Oh, yeah.
Oh, good. Oh, good. And then how about spiritually? Are you
I
taking
go
care
to
of it?
church every Sunday, ma'am.
Beautiful. And then, so you said you've been smoking for a long time. Do you use any recreational drugs?
Well, sometimes when my grandkids come up, they have marijuana. I've tried with them just a few times.
All right. Not too often, though, right?
No, not too often.
All right. And what about drinking? Do you ever consume alcohol?
I do around the holidays.
Yeah, time of year.
Yeah.
It's festive. And then, so has this been affecting your daily living at all? Are you able to cook for yourself, clean, do all your shopping?
Doing my dishes and standing up and walking around the house, it's been harder with this cough, but other than that, I've been all right.
All right. Well, that's good to know, Henry.
Thank you, Hannah.
Is it okay if I check your pulse?
Go right ahead.
I'm gonna put this on this finger. This is a pulse oximeter. It's gonna check your oxygen saturation.
Okay.
Okay, pulse is 86, respirations are 24, pulse oximetry is 88% on room air. Have you ever been on oxygen before?
No.
Okay, well, we'll look into that, because if you're on oxygen, it'll actually help with your breathing and make it easier to breathe.
Okay.
I'm gonna check your temperature now.
Okay.
We'll just do this under the armpit. And temperature is 37.5 degrees Celsius.
Is that okay?
Yeah. And lastly, blood pressure.
I tend to run a little hot.
Okay. I got 154 over 90. Is that normal?
Yeah.
Okay. Can you tell me your name?
Henry Winston.
And can you tell me where you are right now?
I'm in my home.
What city is that?
Chico, California.
And can you tell me what time of day it is?
It's about 9 a.m.
Okay, what was going on before I arrived?
I was just sitting here reading.
Okay, so she's A&O times 4. She appears to have labored breathing. Chest shape is symmetrical and normal, but she is using accessory muscles to compensate. Can I see your fingers real quick? She has clubbed fingernails and is cyanotic. Alright, so if it's okay, I need to check around your chest for any pain or tenderness.
Yeah, go ahead.
Okay. Does this hurt at all?
No.
Any tenderness?
No.
Can you say 99?
99. The best highway in Chico, California.
Alright, can I see your back? Can you take a deep breath? Okay, so chest expansion is symmetrical. but she does have tactile firminitis. Okay, so I'm gonna tap your back a little bit. Just breathe normally. Okay, can you take a deep breath and hold it? Okay, and exhale. Expansion is 2 centimeters, and lungs are duller than usual. Can I listen to your lung sounds?
Yes.
Okay. Just breathe normally. I need to listen to your posterior side. So I hear crackles and rhonchi, and lung sounds are diminished.
Our first nursing diagnosis is impaired gas exchange relating to altered oxygen carrying capacity of the blood as evidenced by an SpO2 of 88% and cyanotic coloring. Our second nursing diagnosis is altered respiratory function relating to ineffective movement of air as evidenced by difficulty breathing. And our third nursing diagnosis is activity intolerance relating to dyspnea on exertion as evidenced by patient stating he cannot walk his dog as far as he used to.
Hello, my name is Patricia. I'm your patient educator today.
Hi, Patrice. I'm Henry Winston.
Henry, nice to meet you. I also heard from your nurses that you'll be needing some oxygen today, and I'll help you with that.
Okay.
Okay, do you mind if I put this?
Go right ahead.
Okay.
Oh, much better.
Much better? Okay, I'm glad. And then I also was reading from your charts and just wanted to talk to you about a couple of things. I read that you are an active smoker. Is that still correct?
Yes, ma'am.
Okay. How many packs do you smoke in a day?
About a pack a day.
Okay. And then have you ever had any interest in quitting or attempted to quit before?
No, I'm really not a quitter, but maybe sometime in the future.
Okay, good to know. I'm sure you've heard before that smoking increases your risk of getting respiratory infections and cancer and all that. So if you're ever interested in the future, I have some resources for you. I'll hand over some pamphlets to you later today.
Yes, ma'am. It's just so hard.
Okay, yeah, I totally understand. And with smoking, where do you usually like to smoke in your home?
I usually smoke out on my front porch over there.
I wanted to go over some safety precautions now that you'll be using oxygen. And so whenever you're smoking, just make sure that your oxygen's turned off and at least in another room. So just try to smoke outside or at least a room away.
Okay.
Do you have any
Me too.
questions for me?
No, thank you so much for this oxygen, Patrice.
Okay, nice meeting you.
You too. Have a nice day and help yourself to some donuts on the way out.
Oh, I will. Thank you so much.
Okay, thank you, Henry.
Thank you, Stephen. I appreciate you coming out.
I hope you have a great day.
You too.
We can see ourselves out.
Yes, that'd be great. Oh, and go ahead and help yourself to the donuts on the way out. My
Are you
granddaughter
sure?
brought me.
Oh,
Yes.
thank you, Henry.
Thank you.
Feel better.
You go first. I don't know what I want.
I'm Patricia. I'm the videographer and also the patient educator.
Nursing diagnoses brought by Katie Dowdy.
Hannah Wagline, subjective nurse.
Stephen Redmond, objective nurse.
Brooke Powers, Henry Winston, 69-year-old with some respiratory issues. Help yourself to some donuts on the way out.